Do a little exercise. I want you to visualize the following scenarios. They are all fictional. Imagine you lost your job 9 months ago due to COVID, and since then you have been struggling to make ends meet. You have exhausted all of your savings, sold all of your valuables, disconnected all unnecessary services, Netflix, internet, cable gone. And because of your strained relationships with your immediate family, you have no one to ask for a loan. Your credit cards are maxed out, depression has rolled in and has settled on you heavy. The panic attacks are making it hard to get out of the house, and with each rejected job application you receive, you sit closer to the edge. You have run out of options. You see an advertisement on a billboard across from your apartment complex offering a free 7-day trial to an online platform for counseling. All you would have to do is download an app onto your phone. You could really use someone to talk to. Your situation is weighing on you very heavy. You've been drinking every day for the last 4 months and you haven't slept in 3 days. Whatever. You connect to the open Wi-Fi signal in your building and you download the app. Maybe connecting to a professional will help. Perhaps. Let's pivot. Now think about this scenario. You graduated last semester from nursing school. You're elated. You're finally starting in a career that you love, psychiatric nursing. You've managed to snag a job at a local public hospital. It doesn't have the best reputation, but beggars can't be choosers, right? You don't have any experience. On this first day, you see why this place has earned its notoriety. The staff is burned out, the patients are acutely ill, mostly homeless, and the facilities are old. Looks like it's from the 1980s. The technology looks like it's donated, and they're still using paper forms. You remember your first patient, an elderly woman. She was brought in because she was found wandering in the parking lot of a supermarket. She couldn't orient herself, so instead of bringing her to the hospital, they brought her here to a psychiatric ward. You take her vitals, she's healthy. She has a couple cuts and bruises. You note these in your chart, and she's very filthy. Where's her family? How long she's been missing? She needs a bath and a change of clothes. So you coax her to the bathroom, you leave her with a mental health tech, and you go to the supply closet to get some shower supplies. As you walk by the nurse's station, you see some patients behind the desk chatting with staff. Not only are their medical charts exposed, but staff personal items are in plain view. You hurry back to help your patient, and as you help her wash up, the extent of the unprofessionalism and the risk you witness hits hard. There's just so much wrong here. As long as you're in this place, you will do everything you can to keep your clients and their belongings and their identities safe. These vignettes illustrate the type of violations that can occur when vulnerable individuals interact with a mental health system that is not prepared to manage information it has been charged to protect. Individuals who in many situations have already been traumatized by life are being set up again to be traumatized by bad actors as a result of poorly trained staff, old technology, and insecure network architecture. Hackers, the term we use to give criminals well-versed in social engineering, are actually quite skilled in psychological warfare, and the byproduct of this skill is always trauma. Just like a victim of PTSD after being bound and gagged while her house is ransacked, a victim of hacking or doxing is shaken, wondering when, not if, it will happen again. They're left wondering if they're being watched, wondering if they're safe. When the doxing includes mental health information, the stakes have been raised. Individuals wonder if this will ruin their career or their relationships. Stigma is alive and well. We still have an issue with people finding their voice to reach out to and to speak out to get help when they are at their lowest. Now, they also have to contend with the idea that the information they share in a private session with a physician, with a therapist, with a crisis counselor, an addictions counselor is not safe. Not because these professionals did not keep the confidentiality they swore to, but because the technology they used could not. This is untenable. An article in Vox by Sarah Morrison that was just released this week said that a survey in 2015 found that nearly 60% of respondents had at least one health app on their mobile devices. And that was 6 years ago, just before the pandemic, when health and wellness app use ballooned. Can you imagine what it is now? Look at your phone right now. How many do you have? As a peer, an ally, an advocate, and as a former worker in mental health care, I know that there is a lot of work to do in order to upskill mental health frontline staff in an effort to fortify these intake points. The use of virtual and telehealth mental health services exponentially increased during COVID, but I will take a guess and say that the cyber skill sets of the staff remain the same. At the same time, we have seen an increase in doxing, ransomware, and also in individuals utilizing social media platforms, specifically TikTok and Instagram, to share very personal information about themselves. I personally have seen TikTok videos from mental health staff in the hospital on the unit making fun of the antics of their patients, at times filming them with only the individual's eyes or face blurred out. When I saw this, I was speechless, sickened, and saddened, and I reported the user. This person with a camera is a licensed professional. I use that term loosely, entrusted with the privacy of an individual who at that moment was ill. We have to protect these individuals from people who have little understanding of how their actions and innocent fun may impact others forever. The internet does not forget. So how do we fix this? We need to put an immediate end to the gatekeeping existing in cybersecurity and open the doors to individuals eager to begin a career. Individuals who are building home labs, paying for, studying for, and obtaining certifications. The students who are interning, give them a chance. Many of them are applying to, but are not landing jobs because they do not have experience. This must end. There are hundreds of thousands of cybersecurity jobs unfilled. Every day, a different company is hit with a new ransomware attack, and we sit and watch while Rome burns down. If you have hiring power, look to those who are searching for a position and mentor them. Bring them on your team. Look for diverse candidates who have not been given a seat at the table traditionally. Career pivoters, experienced workers, Black women, autistic individuals, people with disabilities. Cybersecurity needs diversity. Cybercrime is not a homogeneous problem. Our mental health leaders need to come together to address the issue that is the explosive development of the delivery of psychological services. It is an awesome problem to have. We were once having the discussion that therapeutic services were not accessible. Now anyone with a device and a Wi-Fi signal can access counseling or a support group. Awesome, but now we need to train all of these mental health professionals in cyber hygiene and create comprehensive risk and compliance standards to ensure that the most vulnerable are not victimized by a system that is supposed to support and help them. Morrison's article states that the data collected by mobile health apps is not squarely addressed by existing law, regulations, and guidance. This is a scary scenario. Public-private partnerships must come together to accelerate this movement, bringing together the best minds in the public sector to create health policy with the best minds in the private sector, to root out the vulnerabilities found in our virtual networks and the pain points in the mental health system from the consumer perspective. We also need to evangelize cybersecurity hygiene in mental health settings, train therapists, doctors, and other medical staff to securely utilize telehealth and other technologies where mental health PHI can be stored, viewed, or accessed. Lastly, we all need to continue to work on supporting grassroots efforts to encourage those with mental health conditions to be active participants in their care so that they do have a voice. Too many people receiving services are not adequately informed on the policies that they sign that dictate the access that they have to their own information. If you have a family member, a friend, or you're advocating for someone currently interfacing with the mental health system, please encourage them to ask questions about any or all paperwork they are signing about their medical records, especially those that are being stored electronically. We must hold facilities responsible to ensure that they are employing the best technologies to keep our information secure. They must have the brightest minds on staff, the right consultants in place, and must spend the money necessary to stay ahead of the mental health cybersecurity breakdown that is sure to come if the right crisis interventions are not instituted effectively. Thank you.